In our part of the world, access to healthcare is a problem. The chances of them self-medicating is high.
What are the risks of self-medication?
It can lead to what we call drug interactions. There are some drugs that when you take them together, you can have what we call drug interactions. And you don't know, and this can be potentially life-threatening.
So I have another question about paracetamol. I mean, when we're talking, we said that if one is suffering a minor, let's say it's a headache, what we advise as practitioners is you can take the para, it's just that one time before you go see a doctor. But are there dangers to taking too much paracetamol?
Yes. You know, every drug has its side effects.
Correct.
Every drug that we take has its side effects.
Yes.
So too much of it then can lead to that side effect.
Okay.
Because every drug has its way of working. So if you are taking it either wrongly or taking too much of it, then it's going to have that effect that was not potentially, or that's what we intended it to do.
Correct.
So for example, if you're taking para more than you're supposed to take, or you're taking it too many at a time, then it's going to affect your liver, because your liver is one of the organs that works on all these things that we take, from food to medications.
Correct.
It metabolizes and works on all those things. So then if you're taking too much of para, the little thing, my eye para, my tooth para, my nose para, everything para, taking too much of it and too many at a time, then it's going to affect your liver, and then you're going to have long-term complications.
Okay. I thought paracetamol was supposed to be the safest.
It's safe, but as the saying goes, too much of everything is bad. Yes.
Okay. So there's been cases where this is a regular medication that's been prescribed for a patient, and you take it so often because the doctor says take it anytime you feel this way, which has led to the death of other people too. So now would that be considered a malpractice? Is it the doctor's fault that a patient died because he said it's safe for me to take para when I have a headache before I come see you, and maybe I get headaches so often it means I have to take? So if I get a kidney failure, whose fault is that going to be? Who am I going after? Even though I'm dead, my family have to chase someone.
Generally, drugs have the what we call therapeutic window. So every drug has a certain concentration or a certain duration or dose within which it should work optimally. Okay. So outside these ranges, that's when we have those undesirable effect or adverse effect, or what you call side effect. So as doctors or healthcare workers are generally trained to skillfully use these drugs within these windows. Of course, in some instances, they may need to go outside these ranges just for a certain effect. But because those instances are sort of done within a certain control, they are generally safe, you know. But then, in the context where, let's say, a doctor prescribed a drug, if the patient took the drug, took the drug within that window, that therapeutic dosing or window, then fine, there can be some incidents of litigation here and there. But of course, if the patient, without any care, without any advice of the doctor, takes that drug, then definitely that is more of a self-medication. So in this case, you wouldn't really have the doctor to blame. But aside that, it is just right that as a patient, if you think that you have a certain symptom or illness, or probably a doctor treated you and you probably didn't get well, fine, there are a lot of other factors. We all have different, body physiology and chemistry. Yes. How drugs works in our system differs, you know, and there are a lot of other factors. So if that drug wouldn't work for you, or you think that you are not comfortable, just go and see your doctor. Then they can take it from there than trying to take it on your own and later just develops into something else detrimental and kills.
Okay, so in other words, the fact that Amma took paracetamol and it worked for her doesn't mean that it's going to work for me, because our conditions might be very different and our bodies process things very differently. We're all human, yes, we all know that. It's a painkiller, it's supposed to reduce the pain and give you some kind of relief. But it doesn't mean that specific medications that are working for other people are going to work,
For sure.
because you might be masking something, or it could be worse. So I think that helps. Now that brings us back to this. I'm just learning that people that take alcohol, or too much alcohol, I do take alcohol, but not too much, to a point where I have to wake up in the morning and take something for it. So those who take, is it liver salt? Once they take, when they wake up in a, what's the term for it? You wake up with a hangover, so you have to take. How safe is it for? That is self-medication,
Yeah.
but how safe is it?
I think generally antacids are considered over-the-counter medications.
Yes.
So in that context, it may not really say it's self-medication. But then generally these people, those who take alcohol, those who take alcohol a lot or heavy doses of
Yes.
alcohol, generally develop what we call alcohol-induced gastritis. So it's more of some, alcohol is a bit acidic, so it sort of has some irritative function to the lining of the stomach. And it has a link with ulcer as well. So that is the whole understanding. So these people may have alcohol-induced gastritis.
Okay.
And one of the things, the antidote to some of these gastritis or acid in the tummy is to take a base, which is Andrew's liver salt or Martin's, the liver salt.
Yeah.
Yes, and they have a base, what we call aluminum hydroxide or magnesium hydroxide. So that sort of neutralizes it. So it's not like they are taking it to stop hangover per se, but because they have some irritation in the tummy, and once they take that, it sort of neutralizes or reduces that incidence. So generally that is the whole principle. And it's the same with people who take even ibuprofen
Okay.
or NSAIDs who abuse NSAIDs.
Yes.
They always have this gastritis or what's more like some tummy ulcers, and they would always want to take some sort of an antacid. So it's the same principle, but there's no direct link to whether treatment of a hangover. No.
So in a situation where one is taking it every day,
No,
and I mean every day.
That is a strain.
That is what, that is
so
where the
they'll
question is coming from. So if one is taking it every day because you're drinking every night before going to bed, you really explained it. We know what the point is, but if you're taking it every day, there must be some kind of adverse effect that comes with it. So in this case, you're self-medicating.
Yeah, in this case,
Yes.
you're self-medicating.
All right. Well, we're going to have to go on a short break, and we'll be right back. Welcome back. So, Dr. Laurentia, this one is specifically to you because I just want to be sure. I read something. I know paracetamol, even though it's a first aid and it's advised that you can take it, not too much of it. You just need a little bit of it at a time. If you have to take it too much, it means you need to see a doctor. Yeah. But at what point do we say don't take paracetamol at all? Like, do we have patients with existing conditions that stops them from taking these kind of painkillers? And also, do we have a age range for who can and who can't take certain medications?
Okay, so for paracetamol in general, it's considered quite safe in all ages.
Correct.
But there are other medications like what we call the non-steroid anti-inflammatory drugs, where diclofenac or ibuprofen fall in that group.
Okay.
Normally in children, we want to stay away from those kinds of medications because then it can have adverse effects on them. And sometimes in elderly people, in asthmatics, you have to stay away from all these non-steroid anti-inflammatory drugs because it can trigger their asthma.
Correct.
And also those who have other conditions like chronic illnesses, like these autoimmune illnesses, sometimes they have to stay away from these non-steroid anti-inflammatory
Like
drugs.
liver diseases.
Liver
too.
disease, exactly,
Okay.
because then it can affect or we can give that what we call the drug interaction or either complicate issues, your already existing issue for you. You mentioned the liver disorders.
Correct.
Yes, for liver disorders, paracetamol, in a way, sometimes you have to stay away from it because we know too much of paracetamol in a way can put pressure on your liver.
Okay.
So if you have a liver disease or a liver problem, sometimes you're advised to stay away from paracetamol.
Okay.
Yeah, so those are the times that we tend to say stay away, and then these are the ranges also we ask. Yeah.
All
not
right.
to-
So at a point where a patient or a person is actually overly dependent on a medication, how do we treat them? Because that also becomes a disease on its own.
Yes.
So how, do you have any advice on how we can treat? Like I said, I know healthcare out here is very expensive. Not everybody has a luxury. Now going to a hospital is a luxury because it's very expensive. And when you get in, sometimes the treatment you get makes you not want to go back. Because you have to get a card before a doctor sees you, no matter how bad your situation is, how bad or severe your pain is, you have to buy a card. You know, all of these factors, and it makes people don't even want to walk in. So if I'm overly dependent on a specific medication, what advice would you give if I don't have access to health care? What can I do to stop myself from taking these? And even if I have to see a doctor, is there something that comes along with it?
Yeah, I think that's a good question. Generally, the mainstay will be some sort of a rehabilitation, but as you said, that is more of a hospital-based.
Correct.
But of course, there are some facilities where they can help you with even home services. Okay. But aside that, to make things a bit lighter, you can speak with people who have had similar issues and probably how they dealt with it, and probably get help from that point. But in some cases too, you can just speak to maybe someone that you look up to, or you could confide in, and they could also be of help in some instances. But generally, what I would advise is things like, let's say, alcohol or a certain drug like tramadol. Sometimes you can open up to friends. Okay. Probably this is what you take probably when you are in some sort of, maybe when you are in your happy mood or you probably out for a party. You can do that so that those friends can also help even limit, probably if you have to take, say maybe about 3 bottles. Fine, probably once they know they can be of help, probably they can say, oh, you stick with 1, and they would all understand, because sometimes there's some sort of peer pressure, especially once you are in a team, to take more. But once these good friends are on your side, they know when to also push you and probably maybe when not to push you. Okay. So that can be a way. Then I think the individual can also, I know it's a bit difficult, but it's maybe a bit difficult to just stop at a goal. Yeah. So you can also probably reduce the frequencies of these medications if you could. Probably you are used to taking a lot, a certain amount. Probably so that you can feel a bit high. I know it's a bit difficult because these are neurological.
Very difficult, actually.
Neurological.
It's like an addiction.
It's like an addiction because once your brain sort of makes you feel good, once you take this medication, you feel like you always need more.
Correct.
But it's always difficult to actually manage it yourself. But there are some success stories where individuals use some of these techniques, maybe just seeking help from someone who has had a previous experience, or teaming up with friends so that they reduce the frequency. But the mainstay has always been rehabilitation or some clinical, psychological help. Gotcha.
So under a circumstance like that, there's no way you can try to take care of this yourself. You definitely need to
help.
See. Okay, so we do have therapists and all that around that one can. Is that okay? You know what I'm going to do before the end of this show? I think I'll have to find if there's a toll-free number that people can actually call and get referrals. Maybe go to this hospital, because I know that it's not all hospitals or not all doctor offices that have that kind of help over there. So we'll get to that. Yeah. And now we're going to delve into, most times when we talk of self-medication, we assume that is what I am taking alone, that is self-medicating. As a matter of fact, our parents have been medicating us since we were kids. This is where I mentioned before, their parents who, when the child loses appetite, they'll just say, oh, go and get this, what's the name of those, are they blood tonics? Go get this blood tonic and bring it to stimulate. Meanwhile, you don't know what is really happening to me, and you make me take blood tonics just so I can eat for you to be happy. And in the end, I get health complications, and nobody understands, which is more debt to you as a parent, because you're giving the child medication for something that is probably completely different from what's really going on. I could be depressed and you don't know. And I'll grow up and become suicidal and you don't know where it came from. It started from childhood. You just never took notice of it because you're medicating the child according to yourself. Okay, if I can eat, I take blood tonic and I can eat. So maybe my child can also take the same thing. No, it doesn't work like that. And so if a parent self-medicates a child, and I still call it self-medication because I'm giving them what I think will work for me, what are the dangers to it, and how can we educate more parents to actually desist from doing that?
Okay. So it's one thing that we always advise parents to desist from, because children, the younger ones, their brains and their systems are still developing.
Correct.
They haven't developed yet into an adult.
Yes.
Like the younger ones. So if you are introducing things or you are self-medicating, you are in a long way distorting their developmental growth.
Yes.
At the end, you come back to the hospital and say, oh, my child has delayed speech, my child has delayed in picking up in school, delayed growth. But some of these things we started way before.
Correct.
We have mothers come to you and they are self-medicating their children as low as neonates, early, right from birth. They go out after delivery, and then their mothers or their friends said, oh, you have to do this so that your child doesn't get jaundice, or you need to put this on your child's navel and all that. And you introduce even some medications that go a long way to distort the child's normal development. Right. So it's a no-no when it comes to a parent getting medication, even over the counter for your child, because then children present differently to adults.
Correct.
Because a child might be having malaria but will point to a tummy that tummy hurts, and you might then give an antacid or give something to that effect. So as mothers or as parents out there, we try as much as possible that try to desist from giving your children self-medication.
Yeah.
Always see a doctor, see a pediatrician, or see a GP to understand what is going on, because children, as I said, they present differently from adults. It might even be an eye problem or something that's affecting their throat.
Yes.
They might tell you that, oh, my chest hurts, and you might just go in the end and give maybe paracetamol or something, but maybe there's a tonsillitis or a throat something happening down there. So for children, as much as possible, always visit your doctor for them to be checked and then managed.
So additionally, there are some, as she rightly mentioned, children are now growing, and some of these drugs could interfere with their growth. For instance, some antibiotics limit growth of the bone plates, the physical plates.
Yes.
So you may have your child not growing to the right height, sometimes even size. So some drugs interfere with some of these protein synthesis.
Yes.
That's what makes us gain muscle and grow. So you may have a child which is stunted, who is stunted, and that could be because you probably medicated this child on something. We've also had instances where some of the common analgesics like ibuprofen or diclofenac and whatnot, I mean, these have been linked with internal bleeding excessively. So once you take them, the child could end up with bleeding, and even liver and kidney problems as well. I think the common practice that I have noticed quite recently is the use of creams on children.
Okay.
I think it's becoming a menace now.
What kind of cream?
Bleaching creams, especially for very young children.
Okay.
And it's a big issue. It's something that I have noticed over a certain duration. They start using these creams very young at a very young
As in
age.
bleaching
bleaching.
infants.
Yes.
They tend to say, or there's this advertisement going around that your baby will maintain their natural color. You know, when babies are born, they are kind of pink, or they look pink. So then they tend to have the idea that that is how my baby should look when it comes to complexion. So then they go and buy some of these, some knowingly or unknowingly, they buy these creams or medications or soaps they use on these babies with the intention of maintaining their color from birth, which I think is becoming a menace.
But what's the point? And okay, now this is new to me, so I'm a bit, I'm stunned because this is an infant.
Yes.
He or she, the baby is going to grow into what it's supposed to be and look like. So trying to alter that at that early age is not going to change how he or she is going to look when they get to the proper age.
Yeah.
So what is the point in see, as an adult, if you want to alter your skin color, it's okay. That is your choice. It's okay. What's the point in trying to do that to a baby?
I think it still boils down to education. You are even seeing this in not illiterates, but even literates, because then maybe you think you're looking a certain way. Maybe I'm fair, so automatically my child should be fair, irrespective of your husband or even your thinking about your genetics. Your complexion doesn't really just depend on the parents sometimes. So the fact that you are fair doesn't mean that automatically your child should have the similar complexion. So sometimes they are forced to say, oh, I'm fair. Why is my child looking a bit dark? I need to get my child back to its fairness. So I think we have to educate more when it comes to this.
But parent, are you aware that any lotion you put on your body has chemical reaction to it? I mean, all these lotions that are being mixed up for us to use on daily basis are all chemicals. So why do that to your child? As an adult, if you're bleaching and that has that much effect to alter your actual skin color, imagine the absorption or how bad it is going to be on a child. That is also part of self-medicating, actually.
Yes.
Please, if you're doing that to your baby, if you love your child, I don't think you'd want to continue, because it'll get to a point where, see, if you use a specific kind of cream for too long, at a point your body does not even accept it anymore. It doesn't work right for you anymore. So imagine a child from, what, 6 months, or what? Some do it as early
as 1 month. Yes.
As early as 1 month, you started this. So imagine when the child turns, let's say, 5 years. Now,
realize some of these children tend to come to the consulting room with a lot of skin diseases, skin infections, some
skin cancers.
Yes, skin cancers. And now you realize that these cancers or childhood cancers are on the rise. Back in the days, we hardly find children having cancers commonly, but now when you go to the cancer unit, you are seeing all sorts of cancers. Sometimes the mothers tend to ask us why their children are having these cancers. But some of these things go a long way to change these things in their bodies, and it can go a long way to also cause cancer. So I think that will be another topic for discussion next time.
Please, if you're watching this and you understand what is going on here, if you know anybody doing that to their child, please alert them. Maybe they don't know. A lot of people, like I said, a lot of us are ignorant in so many ways. I mean, I was ignorant of some things when I sat down. I'm learning a lot from these doctors. I'm sure you're learning something. You're ignorant. I'm not trying to disrespect anyone. I mean, you have your own reason for bleaching your child, but we're all learning. Like I said, self-education is better than self-medicating. So now you're educating yourself, and you've educated yourself enough to understand that bleaching your child from infancy could lead to a whole lot. If you want your child to actually live a full and fulfilling life, please and please desist from doing that. Whatever creams you're using, if it's only been a year, I think that should be enough. And just learn to read. Whatever it is that you're ingesting, whatever you're giving to your child, please read about them before you do that. That is called love. Love is not trying to alter the looks of your child. That's not love. That is you trying to impose what you would want to look like on a baby that knows nothing. But now you know something new. Try and avoid that. People are dying for kids. Don't do that to your baby. We've actually covered a whole lot today, and I'm hoping that we're all learning from this, because that's the whole purpose of this show. We're here to educate. This is information you hardly get. You have to see a doctor before you get certain information. Like we're talking about self-medication right now. It's a household pandemic. It's something that people don't sit down to talk about. All we do is, oh, yesterday I had a headache, I took this. And my friend is telling me she's also experiencing headache. Oh, I took this, it worked for me. You two do the same thing. And it's been going on and on and on. And it's actually killing people. If you see the death toll right now on the youth, now it's higher than it's ever been. Now, you wake up every day and you hear somebody 32 years, 27 years, 35. They're too young to die. You've not even lived half of your life. It all this whole thing, it boils down to things that we're taking, we're ingesting, that we're not supposed to take. We're masking a whole lot of diseases. I mean, genetic disorders that we don't even know, because we're taking other medications that are covering it up. So we're not seeing it until it's too late. A lot of people don't even want to see the doctors. They just sit around until they're on the verge of dying before they walk in and say, hey, this is what is happening. And the next day, you hear they're gone. You do not want to find yourself there. Today's show, we're going to end for now. We're going to see you next week. Thank you very much for watching.
Start today, you get health tips with Dr. Daily. Yeah, giving you all the health benefits you need for your better life. Watch this show, Health and Life with Dr. Daily. 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 Health and Life